Welcome to the Gynarchy Podcast. This is your host, Dr. Kirti Patel. Here we place women's health and feminism front and center where they belong, engaging in conversations that range from the fundamental to the fearless. With insights from expert guests, we aim to break through the barriers of the patriarchy and envision a new world led by the Gynarchy. So let's get started and dive right in. Welcome to the Gynarchy Podcast. This is your host, Dr. Kirti Patel. And today we're going to be talking about egg freezing with Dr. Aimee Eyvazzadeh. Dr. Aimee, the egg whisperer, as she's popularly known, is a fertility specialist with over 15 years of experience residing in the San Francisco Bay Area. She graduated from UCLA School of Medicine, completed her residency in obstetrics and gynecology at Harvard Medical School, completed her fellowship in reproductive endocrinology and infertility, and holds a master's degree in public health management and policy from the University of Michigan. She launched the Egg Freezing Party in 2014 and since has also launched the Egg Whisperer Show to educate the public about their fertility. She has been seen and quoted on numerous news and media sites, including the New York Times, Forbes, USA Today, NPR, and more. So welcome, Aimee. How are you?
Thank you, Kirti. I'm doing great. It was so fun to get this invitation. I'm just so delighted to be here today talking to you.
Thank you for being on. So please tell us a little bit about yourself and how I've given a little intro, but tell us about what brought you to this field and, inspires you.
Yeah. So this room that I'm sitting in is actually the same room my father practiced in for 40 years. So it's kind of in my blood. It's in my DNA. I started working for my dad when I was 12. Last week, I saw a patient. She was 39 years old. And after the new patient called, she said, "I just want you to know something really special." I said, "What?" She said, "Your father delivered me." And I got goosebumps. So,
wow.
Yeah, and I've always been so fascinated by, how something so tiny like an egg can bring someone so much hope and happiness. And I literally get chills when I do an ultrasound and I see someone who, we're waiting for her follicle count to go up and all of a sudden it's a little bit higher. And I get tears in my eyes and literally I have hairy arms because I'm Middle Eastern. You can see the hair come up and it just never gets old. It's really fun for me. So I came to this because of my family experiences. My mom also had miscarriages. And I just know all too well how painful and how much heartbreak comes with going through miscarriages and infertility. And I just wanted to dedicate my life to it. And I did at a very young age.
Amazing. So did you have experience also working in your dad's office before?
Oh, absolutely. I started working for him when I was 12. As a medical assistant, I would room his patients.
Wow.
I would take their vitals. I would weigh them. And I would tell my dad, back then it was all paper charting. And I would be his chaperone in the room, assist him with procedures. So I would do that on all my vacations. I would do it every summer and until I left for college.
Did you know you wanted to go into the same field?
Oh, yeah.
Because of that experience? Okay.
Yeah. 3 years old, I knew I wanted to be an OBGYN. 7th grade, I knew I wanted to be a fertility doctor. And then in college, every summer, I would actually go to Harvard and I did research at the recurrent miscarriage center that they had at Brigham and Women's Hospital every single summer. And then, I started doing research really early on, in college and medical school, all the research dedicated to studies on fertility, infertility, and miscarriages.
That is amazing. My goodness. Because your entire life you have way more than 15 years, over 15 years of experience.
I do. It's generational experience.
Yeah.
Generational. Yeah.
Like dinner table talk for you.
100% dinner table. I still call my dad about things, especially when my pregnant patients have pregnancy issues and, they're asking me a question about something like my AFP is elevated. What does this mean? And I say, let me talk to an expert. I'm like, Daddy, what would you do? What would you say? And then he'll tell me and then I'll tell the patient.
That's so amazing. I know. It's like you could probably, you're the perfect person to talk to. You can do this in your sleep, I bet.
Yes, that's really fun. I'm very lucky.
So, the reason I wanted to choose this topic is because, culture is changing because of many factors, women's career goals and modern dating and the political environment we're currently in and all these uncertainties in the world. And a lot of women are choosing to, stay single or not have children or defer having children, or start having a family, starting families. So, I thought egg freezing, would be a great topic because I think it's become really mainstream. A lot of women talk about it, and you just seem like the perfect person. So, I guess I want you to explain what these egg freezing parties are. Like, what inspired that? And then, what is it like?
Yeah, I mean, back in around like 2012, 13, there were so many parties that I was getting invited to, like the purse party, there was the passion party, there was the Botox parties. And anytime I would go to one of these parties, people would know what I did for work, or, someone would tell somebody. And then it basically turned into a party where I would just educate people about fertility. And then I had this thought, and I said, well, what if I actually created something similar, called it an egg freezing party? And basically, it's, a biology lesson with some champagne. And
Love
it was
it.
so much fun for me because it wasn't about selling egg freezing. It wasn't about convincing women that they should do it. It was about educating women about fertility. Because I feel like if you know the process of egg freezing and you understand the biology of the eggs, then no woman at 42 will ever say, I wish I had known this sooner. So I just
Right.
wish like every woman should take the egg freezing class. I'm obviously biased. That is now what the egg freezing party has turned into, because once COVID hit, I stopped doing them in person. And now they're just online parties where, people can sign up, they're over Zoom. I still do my presentation. I still try and make it fun. And then people ask me questions in the end. So that's basically how it all started and where it is now.
Okay, brilliant. I mean, I do think like women do not know, we don't get enough, education about reproductive systems and how they work. So
Right.
I think that's amazing. And I love that it's online. So it's not just in person in the same, do you do in person as well in the San
I
Francisco
do.
area?
Yeah. I mean, I've had, let's say, companies invite me to throw them, so to speak, at their, at their, I've had
At their
companies,
sites, like companies.
yeah,
Okay.
I've had
Yeah.
companies invite me on site to give an egg freezing party, so to speak. I've had people invite me to their homes where they gather a whole bunch of women, and I'll throw them there where they'll have a big screen and I'll give a PowerPoint presentation. But yeah, for the most part now it's mostly online.
So, okay, so if you have it online, is it just people that could be potential patients, or can anybody sign up for these?
Anybody from all over the world. And it's so fun to have someone from Nigeria, then someone from Australia, someone from Germany, all in the same room. And
Okay.
they all want the same thing. They just want a better chance in the future. What I call your future, they want to freeze assets and have egg assets for themselves in the future, should they want to have kids or want to have more kids or maybe have a change of partner.
So that's amazing. I guess you have a Q&A session, I
Yeah,
imagine, so anybody
totally.
can ask
Yeah.
questions.
Yeah, scientific presentation, then a Q&A session. I don't leave until all the questions are answered.
Oh, wow. So, I have a question like, do you ever get critique that you're, I think this is fabulous what the information you're providing, and also, women should be educated about this fertility option. But do you ever get critics saying that you're, perhaps taking commercial advantage of like women aging and their declining fertility, or, you know,
Yeah, I think it's unethical not to give women these options. Some people actually say, I think the word is exploitative, right? That we're
mhm.
exploiting women. And I get it, but I see it differently because we're giving information to women that's empowering. Because until menopause is reversible and not inevitable, egg freezing is the only way to prevent infertility. 100% of us will become infertile. And with how things are changing in our society, so many women run out of eggs before they've even started their family, right?
Right,
So
and they
there's so
don't
many,
even know it. Right,
and
they
they
don't even
don't
know that
even
that's
know it.
happening.
Right. And so I just don't tell women what to do. I basically hand them the menu and say, these are your options. And do you want the egg freezing option? And at least you had the option. So if you run out of eggs and you're in that situation, you can never say and have regret about things that you could have done in the past. And I see so many women coming in, let's say at 42, 43, they're ready for their second child, or they're just starting their family. And they're so angry because no one talked to them about them or offered it to them. So at least with egg freezing and thinking about it, even if you don't do it, you're not going to have regret in the future if you chose not to at the time that you were presented the option.
Okay, so what about, you're in the San Francisco Bay Area and
Yeah,
you mentioned getting invited to these companies. I imagine they offer this as a benefit sometimes, right?
yeah,
Like egg freezing. But I mean, how would you respond to the critique that, like where we have this culture in the US, like this workaholic culture, and instead of slowing down and promoting, giving people time off to have families and having maternity leave, like
right.
appropriate time in their lives to set aside time for this, that we're promoting like,
Staying in the
women freezing
workforce
their eggs
longer.
and staying in
Right.
the workplace and just becoming, like just, with the goal of, capitalism's goals.
Well, I think the thing is these companies are smart because this is what the women want. This isn't what the companies
Mm,
are doing to exploit their employees to get them to work harder and longer and not have babies. Egg freezing became covered by Facebook and Apple, not because Facebook and Apple came up with the idea. It's because their
mm,
employees went to the company and said, "This is what we want." And then companies realized in order for us to bring in this talent, and retain the talent, we need to cover egg freezing. So women look for employment opportunities based on the fertility benefits that they're offered. So the companies basically to compete for very talented women, they have to include these benefits. So
mhm.
if companies decided not to have them, then they might not be able to have the talent that they have because this is what women want. It's not the companies saying, "I want you to work harder and longer and not have babies." Could we do better as far as maternity leave, paternity leave, and supporting women in what I call trimester zero before you even want to get pregnant and in the first trimester and after you have a baby? Absolutely. But egg freezing is also part of that too.
Okay. Yeah. No, I do agree with you that I do think that women are interested in this, and they want to be able to have the flexibility of choosing when is the right time for them and not being dictated by the biological clock, right?
Right. Right.
So, okay. So, thanks for I went right into the tough stuff. But now let's go back to the basics. Can you explain to someone who is a young person who is just hearing about this, like what is egg freezing?
Yeah. I mean, the process is straightforward, but it has to be taken seriously because in the end, it does involve stimulating the ovaries with medications that are in the form of a small injection that you take nightly for about 2 weeks or so, pelvic ultrasounds. And what we're looking at are follicles that are growing. So, what does that mean? That means that the ovaries are going to produce more eggs. And once you see the number of eggs that you think is the right size and number for us to go and retrieve them, then the woman will undergo an egg retrieval procedure under anesthesia. It's not the kind of anesthesia where you have a tube and machines are breathing for you. It's just a sedation where you're taking a quick nap. So it's straightforward, but it's very emotional. So you have to realize that you're going to have side effects during the procedure that might impact your mood. And once the egg retrieval is over, if, for example, you didn't get the number of eggs that you wanted, it can also be a very emotional process. And then the mood swings that happen once the hormones are out of your system should not be taken lightly either. So, being educated about the process, the side effects, asking your doctor how many eggs that they expect for you. And then after the egg retrieval, asking them if this makes them happy and if you should freeze more. I think that goes all into an egg freezing education for a patient who's going through it.
So, what kind of testing or preparation is involved before you start a process like that?
Yeah, so I'll share with you the testing I do. So, what I like to do is look at a patient's ovarian reserve. I want to know what is her fertile potential right now and how many eggs do I think, based on what I learn about her, her levels, her age, her family history, that she needs to freeze in order to have over a 50% chance of having 2 kids. So that's how I design an egg freezing plan for a patient. I also do genetic screens. I do a carrier screen, a chromosome analysis. If there's a history of cancer in the family, I'll do an inherited cancer gene test. There's also infectious disease tests, a blood count. Thyroid is something else that I check, a prolactin and a vitamin D. So those are the basic tests that I do up front, as well as a pre-egg freezing ultrasound, looking at the uterus, looking at the ovaries. I want to know if a patient might have a pre-existing fertility threatening condition, because she might want to know sooner than later that she actually has to use these eggs for a future baby. For example, let's say she has severe endometriosis that I've diagnosed for the first time. Well, patients who have that condition may need to use their eggs at a higher rate than someone who doesn't. Let's say she has a history of chlamydia. She's had it twice. Well, I'm actually going to check the tubes of my egg freezing patient. I do it while they're asleep for their egg retrieval, because we know that if your fallopian tubes are blocked, the only way to get pregnant with a baby using her own eggs is through IVF. So she'll have to use those eggs. So those are the kinds of things that I think about and I talk to my patients about beforehand. I also talk to them about being the healthiest version of themselves, eating healthy, sleeping well, hydrating well, taking their supplements. I design a personalized supplement regimen just for them that includes CoQ10, a multivitamin, and there's a great brand. It's called, what is it called? Bueller. You would think that I would know the brand. I cannot remember the brand. It doesn't matter. So just a multivitamin, CoQ10, and an NAD booster like OVA NAD+. So those are the 3 things that I make sure patients are taking at least 30 days before they start their stimulation cycle.
Okay, I was going to ask like how soon before. So the number of eggs that you want to retrieve, et cetera, it's all very personalized to the patient and their history.
Absolutely. That's a really good point, because I can have a patient that has 20 follicles. Okay. But 20 follicles means feeling super bloated if I get 20 eggs. And there are patients that just don't want to feel that way. They would rather go through 1 or 2 extra egg retrievals without the discomfort, without all the side effects, and maybe get 5 each time. So I'll always ask the patient, do you want me to set your dose in a way that I can maximize our chances to get as many eggs in this cycle? I would say 8 out of 10 patients will say yes. 2 out of 10 will say, no, I'm good. I'd rather, you're cool, Aimee. I'd rather hang out with you and do 1 more cycle and just have it be a super chill cycle where I'm not super bloated afterwards.
So you mentioned side effects. Besides bloating, what are some other big ones?
Headaches, nausea, cramping, egg white cervical mucus, which is really common, but it causes people to panic because they think they're ovulating, but that's how your body responds to high estrogen levels. Some spotting after the egg retrieval, and then severe PMS and a period that feels like a waterfall has come. I had a patient the other day. She's like, she took a picture of her pad and she sent it to me. You should see all the pictures. I'm sure it's very similar to yours.
Yes,
Took a
I
picture
see
of her
all kinds
pad.
of things.
Yeah. She's like, should I go to the ER? And I'm like, no, this is a very healthy period. This is expected after an egg retrieval. And I always educate my patients about that. And they clearly all have my cell phone number because they all text me as well. But those are basically the more common side effects, but there are also more serious side effects like ovarian cyst rupture, severe ovarian hyperstimulation syndrome. These are the kinds of things that can send someone to the hospital, and things that are important to talk to your doctor about, because you want to ask them, am I at risk for severe OHSS? And what can I do to prevent it? And there are certain things that we do as doctors, like use Lupron as a trigger shot. I have my patients increase their protein intake to 100 to 120 grams per day during the cycle. I have them hydrate really well with electrolyte salts. I also use other medications like bromocriptine, letrozole. Sometimes I'll continue the antagonist called ganirelix after the egg retrieval, all things to bring their estrogen levels down so they stay nice and safe.
Okay, interesting. Now, what are some long-term risks with this procedure?
There are long-term risks. And so for patients who go through egg freezing, especially if they have a history of endometriosis or fibroids, it can stimulate inflammation in the uterus and growths that are estrogen sensitive. So it's really important to know that going in. And so if I identify issues like that at the very beginning, I will verbalize that and make sure the patient knows that. And I'll also tell her these are also fertility threatening conditions, so you might want to consider getting pregnant as soon as possible. The other risk is depression, anxiety, PTSD. We're all overachievers, OVA achievers is what I should say. And as an overachiever, everything we do in life, if you work hard, you're going to get exactly what you want. That's kind of how we're raised. And when it comes to egg freezing, it couldn't be far from the truth. It's
Mm,
out of our control, right? The number of eggs you get, the quality of them. And so for some women, it can be very depressing if the right expectations aren't set up from the beginning. So if you go in thinking 10 follicles will equal 10 mature eggs and you get, let's say, 3 mature, you're going to be extremely disappointed, very sad. So that's why I think talking to your doctor up front about what how things will go as the cycle evolves and what will happen once your eggs are frozen and who will be talking to you about how good they are and what you should do next. I think that's important because sometimes those conversations don't happen and women feel like that they weren't educated enough about the process and they didn't freeze more eggs. So I think the psychological impact of cycles that don't go as well as you had hoped is one of the more common serious side effects. And I take that very seriously. So I actually have my patients review a list of questions like, how will you feel if this happens? How will you feel if that happens? If you don't get as many eggs, how will you feel if, you don't end up or you end up using your eggs and they don't turn into the healthy embryos that you were hoping for? So I give them the list. I give them the name of a fertility psychologist, and they have the option to talk
okay.
to the psychologist about the questions and their answers.
Okay. I did not even know there was fertility psychologists. So
Yes.
people,
Yeah.
they specialize in that. That's
That's it.
excellent.
Yeah.
Okay. Any other long-term risks? Like, is there a risk of increasing risk of ovarian cancer?
So luckily there is not, unless you're exposed to a medication called clomiphene citrate, also known as Clomid. So the American Society for Reproductive Medicine published a really nice study, finally, after all these years in
Mm,
2024, titled Fertility Drugs and Cancer Risk. And they went through all the different cancers, like breast cancer, for example, doesn't increase the risk. Ovarian cancer, slightly increased risk. But what they found is more in women who are exposed to this drug called Clomid, which I do not use in my practice. And most
mm.
doctors do not use it in their egg freezing cycles. And it's really women who are exposed to multiple rounds of Clomid.
Okay, so now I'm just interested because Clomid's often used for PCOS patients. So, is it, I'm assuming it's dose dependent risk,
Not at all. I
No?
actually
Oh,
think Clomid's a very dangerous drug and should not be used. We use letrozole, also known as
oh,
Femara, for PCOS patients. It's far superior. So Clomid has serious mood side effects. It thins out the lining, and it's not as effective for PCOS patients. So letrozole is the first line therapy for women who need ovulation induction who have PCOS.
wow. Great
Yeah,
to know. Thank
yeah.
you. So what age should patients, women out there be thinking about this?
So if it were up to me, every woman would have a conversation with her mom by the age of 25 about her mom's fertility, because
Hmm,
we know a lot of it is genetic. Did your mom have fibroids? Did your mom have adenomyosis? Did your mom have endometriosis, miscarriages, early menopause? And then I would also want every 25-year-old to get her AMH level checked. So AMH is the closest thing to a sperm count for women. Men can just use a cup and see the quality of their sperm. Unfortunately, the AMH really doesn't tell us much about quality. However, it gives us a window into how open a woman's fertile window is. So it's kind of like a menopause test in a way. So if your levels are low, you might actually want to freeze eggs sooner. If your levels are average for your age, which is a good thing, then if you're 25, I don't think you need to rush to freeze your eggs. However,
okay.
the younger you are when you freeze, the healthier they will be when you're ready to use them. And so, is there a big difference between a 25-year-old's eggs and a 32-year-old's eggs? Not really. But I recommend to freeze by the age of 32 if you're really thinking about doing this to give yourself the best chance of pregnancy. Have I frozen for patients at 35, 37, even 39? The oldest patient's eggs I froze to have a healthy pregnancy was 43. And the reason why is her husband actually couldn't collect on the day of the egg retrieval for the IVF cycle. So I had to freeze her eggs and I ultimately used them later. But my
Oh,
point is, egg freezing is for everybody. And, even if someone says your chances are low, well, I can tell you if your chances are low, they're going to be a lot lower when you're older.
that's really interesting that you recommended by age 32. That
Yes.
is like a lot. Is that what most, infertility doctors are recommending? Is that the general
I mean,
recommendation? I
I've
didn't
heard
realize it was so young.
I've heard doctors recommend by 28. So,
Okay.
at 25
Okay.
year old's eggs, most will be genetically normal. At 32, it's probably 50-50. But, when you have so many eggs, you're just going to be a lot more symptomatic going through the process compared to like a 32-year-old. And a 32-year-old's more mature potentially than someone who's in their early 20s. So it's a lot to kind of go through, I think. But a lot of women are very, ready even at like 23 to freeze their eggs.
Mm-hmm. So that window, that's a good, like, where good age
Yeah.
for quality of eggs as well, right? In your opinion,
Correct.
is there an age where you say the quality declines or like starts declining? And is there?
Yeah, and that's the reason why we want to check those levels and talk about family history even
Okay.
at 25, because for some women, it might be younger. I mean, some women go into menopause or start having perimenopausal symptoms at 35 and they're done by 40.
Mm-hmm.
So for them, freezing at 32 could be too late to get, they might have to do multiple rounds. I had one patient, I did 11 rounds of egg freezing for her to get 11 eggs. And
Wow.
she was, yeah, and by the time we were done, I think she was 31 years old. And now she's in menopause, or what we call it, she has primary ovarian insufficiency. So everyone's story is different. And had she not checked her AMH when she did, she would just not have known because she was on birth control pills. And that was
Mm-hmm.
masking her diagnosis.
So you mentioned, so a couple questions there. So is that like what is your like ideal number of eggs that you like to have for a patient for this
Yeah,
for,
it
for this
depends.
purpose?
Yeah, I mean, it depends on age. If you're doing it in your early 20s, if you have like 15 eggs, you should have plenty for 2 kids. If you're 37, you might want to have 30 eggs to give yourself at least a 50% chance of having 2 kids. So it just really depends on how old you are when you are going through the process of egg freezing.
Okay, okay. And then is there an ideal age you should use your eggs by?
That's a really good question. And so what happens is women will sometimes freeze their eggs, forget about them, meet the right guy at 43, and then, they want to date, travel the world, and then not, get before they get married or whatever. And then they're ready to use them at 46. And then they thaw all of them and none of them are healthy embryos. And they're so mad. They wish they had known that sooner. So one of I call them my egg whisperer golden rules, is that if you haven't used your eggs by an age where you still have eggs left, consider making embryos just with maybe 6 eggs. Maybe consider donor sperm. Because what you want to know is, what is the viability of these eggs? Because eggs are a chance for an embryo. Embryo is a chance for a baby. And so if, let's say, you thaw the eggs and learn that none of them were healthy, then you have an opportunity to still freeze more while you still have eggs. So it's not that you have to get pregnant before you hit menopause. No, but you might want to at least create some embryos to make sure that you shouldn't freeze more before you run out of eggs. We know that pregnancy complications increase as a woman gets older, right? So preeclampsia, diabetes, and preeclampsia is the most serious. So do I want women to wait until their 50s to have babies? No. Are they doing it anyways? Yes. I probably have 3 50-year-old plus patients pregnant right now. So, I mean, I want my patients to get pregnant as soon as possible because I want them to be parents as early as possible so they can be here on this earth as long as possible to support their children and their families. That's just my bias. But medically speaking, if you can have your babies by 40, you're going to have lower complications. But does that mean you cannot if over 40? Absolutely not. You certainly can. Could you have a baby at 50? Sure. Is it going to be more complicated and come with a lot of risk? Yes. So as long as women know that, you just can't wait forever to use your eggs and expect that you're going to have a healthy, perfect pregnancy. That's okay.
Okay, yeah. So I think that's an important point. Like freezing your eggs in your 20s makes it seem like, okay, you'll be all set because you have
Right.
20-year-old eggs, 20-something-year-old eggs. But really, your age plays a factor as well with things like
Right.
miscarriage and whether it takes, right?
Right.
So, and also, I imagine sperm quality of their
Oh,
partners,
yeah.
right? Or sperm
Absolutely.
semen issues, right? Semen,
Totally.
yeah.
Yeah. I mean, most women in their 40s aren't shacking up with a 25-year-old. They're
Hmm.
shacking up with a guy that's their age or older. And we know that there's an increased risk of very serious problems like autism and chromosomal abnormalities, especially if the paternal age is 50 or more. There's this horrible thing happening right now where the government's trying to convince us that Tylenol causes autism. I'm like, that's ridiculous. What causes autism, I think, in our society now more than ever is actually advanced paternal age, because more people than ever are having kids at an older age. It's the older guys. It's not the Tylenol.
Say it louder for the people in the back.
Yes.
I love that point. I mean, I'm always talking about that. And I tell patients that because
Right.
the patriarchy does make for infertility issues a woman's problem when it's
Yep.
really not that.
Mhm.
So you mentioned earlier, sorry to backtrack because this is something I was just pinning in my head. You mentioned, they've been on, patients being on the pill, so they don't really know what their fertility status is. So I guess my question was, like, how long do you recommend a patient, take a break from the pill before testing their, doing their AMH, let's say?
Great. So you actually don't need to take a break. And the reason is we can still interpret your AMH while being on the pill. The birth control pill will suppress AMH by about 20%. So if I have a patient that's on the pill and she wants to get her levels checked, I say, go do it. And then I'll look at her level. If it's super low, I'll say, you know what? It probably makes sense to stop your pill now and start freezing eggs and retest your AMH just to see where we're at. But I'll typically share with them that we can expect that the AMH will be about suppressed by approximately 20%. I'll take that into account when I interpret her level with her.
Oh, okay. Okay. So if it's borderline and they're on the pill, you
Yeah,
say it's probably in the normal range.
it could be. Yeah. So then
Okay.
she might want to stop it and recheck, but I would say that's an opportunity to now take action and go ahead and
Right.
freeze eggs.
Right. So, yeah, I mean, if patients have, interest in fertility issues, I tend to refer. So you can have this full discussion, of course, with another doctor like yourself.
Yeah.
But do you think there's a, argument to be made for a generalist like me, a gynecologist, for doing an AMH yearly, like just to keep tabs on it and refer as needed?
100%.
Okay.
Absolutely. I mean, that would be
Okay.
amazing. I mean, it doesn't necessarily need to be yearly for someone who's in their 20s or early 30s, but especially for the women who've already had a baby. So I feel like one opportunity that's missed so many times is, you just had a baby, you go for your postpartum check, and everyone's talking to you about birth control. What they should be doing is, especially in these women who haven't had fertility issues, is checking their AMH and talking to them about their next baby, what the interpregnancy interval is that they're considering. And if they learn that the AMH is low, maybe encourage them to freeze eggs or freeze embryos. So secondary infertility is something that's skyrocketing because women are having babies later. So most women are only able to have one baby unless they want to consider creative family building. So that's one thing. If I could rule the world, I would send everyone a kit to check their AMH as part of their like postpartum present after they deliver. And also a sperm freezing kit too.
That's interesting because we often tell patients, right, in OBGYN that once you've had a baby, you become more fertile.
And that's not a thing. That's not. And so if everyone
Okay.
says that, especially to my
Yes.
IVF patients, and they're like, I'm like,
Yes.
you did 9 cycles of IVF to have this baby. You really think that all of a sudden, I was like, no, what you feel is more fertile. You
Hmm.
feel that way because you just did something so amazing, but it's not like all of a sudden the body knows how to make an embryo and have it
Right.
implant in the
Right.
uterus because you had a baby.
Right. Right. Because they're still aging. There may be a gap between
Right,
kids, right? Of course. And we
right,
recommend a little bit of a gap. So,
right.
do I mean, I imagine the success rates are going to be very different for fresh and frozen eggs, right?
Mhm. Especially if they're younger versus older eggs. So young frozen eggs do really well. They're not as fragile, they're really strong. Older eggs are more fragile, so they don't survive the thaw as well. So typically, I would tell a patient, yeah, I'd expect probably most of your eggs will survive the thaw, probably 98%. However, if they're older eggs, maybe only 30 or 50% will survive because they're so fragile. So this is why I encourage older women to consider making embryos, maybe doing 1 cycle with embryos, and then maybe doing 1 or 2 cycles just with eggs. So you have options in the future in case you want to become an independent mother.
Okay, yeah. And like how often do these conversations lead to patients? I know this is like, you can just be approximate, but how often
Yeah.
does it lead to women actually just proceeding and having children, you know?
A lot of the times they say, I don't want to wait for the love of a man. The love of a baby is more important to me. The love of a man will come when the time comes, but my eggs are running out and I can't wait for them.
Yeah. I mean, that's interesting. I say something similar when women are thinking about this and they're still single and they're worried about it. I say, we have a window, right, to
Right.
have children, but we don't have a window to meet a man. You have your
That's true.
entire life.
Yeah.
And
Yeah.
yeah.
And there's something that's so transformative that happens when you have a baby. You're just now open to meeting your social network changes significantly. You're meeting different people, how you see the world changes. So, the man that you were meant to meet might not have come had you not had a baby first.
Yes. And while romantic love is lovely, like I really do feel the greatest love on earth is parent-child
Yeah.
love. That's my personal bias, I guess.
Yes.
But yeah. So what are some common misconceptions you'd like to share about this? What you often
Yeah.
share at these parties that you feel like
Yeah.
everyone should know.
I mean, the common misconceptions, the biggest one is that egg freezing is an insurance policy. It is not. It's basically a lottery ticket with improved odds if you buy it young. Another misconception is that women only do it if they're single, but I think it's something even for married women to do. And I'll tell you why. Sometimes married women, they tell their husbands they want to freeze embryos. Their husbands are not on board. They don't understand and they want to do it the natural way, but they're basically robbing their wives' chances of being able to have future kids by blocking and standing in the way. So egg freezing can be done without your partner's permission. You don't need a man to freeze your eggs. You don't need them to sign off on any consent forms. So that's another misconception that you can't be married to do it. So egg freezing, I think, is for single women, for married people. It's for anyone who wants to give themselves a better chance in the future with younger eggs. It's kind of like an assurance policy, not an insurance policy. It gives you better assurances that you might have a better chance with your younger eggs. And I tell people all the time, become your own egg donor. Most women over the age of 40 have to use donor eggs. That's just the reality. Most women cannot get pregnant because their eggs are too old. That's just reality. It's not me being mean. I'm not, trying to say something that puts women down. It's just human biology.
Yes, it's
But
facts of life. Yeah.
yeah. And if you just
I
freeze your eggs, you can use your own.
Yes, and I see a lot. So, let's talk about that a little bit. Like, you know, you mentioned you have some patients, a handful in their 50s, and that's probably something at a low level you have continuously. But I feel like a lot of times we don't know all the details of like these really high profile people having babies really late in life. And I think there is a misconception out there that it's easier than it is, right? And we don't know if they're really using their own eggs, right? What are your thoughts on this?
Well, they're definitely not using their own eggs. I mean, if you look at Janet
Okay.
Jackson, for example, she had a baby in her 50s. Back when she did it, egg freezing wasn't even a thing. It wasn't even possible if she were to have done it at an age where she still had eggs. But after she came out and said, I had this baby, all the 50-year-olds were reaching out to me and saying, well, if Janet Jackson could do it, well, Dr. Aimee, you're the best IVF doctor. You should be able to do it for me too. And I'm like, well, yeah, here are the websites. Like, this is education about egg donation. And they're like, what? No, I want to use my own. I'm like, but you don't have any. Like, the chance of a 50-year-old being able to go through IVF and have a healthy embryo is zero, period.
Mm.
So it's just not possible. And then I do get challenged. I have patients say, well, my neighbor was 50 and she had a baby. And I say, well, you know what? My father had one patient in over 40 years of practice, one patient at 50 who had a healthy baby. The oldest patient that I've had that had a healthy baby was 47. And we're talking about 18 years in private practice and 20 years since I graduated med school. And all I do is focus on fertility. So the likelihood of it happening with your own eggs when you're over 50, like for example, Naomi Campbell, same thing. She now has two
Mm.
kids and she's not coming out about how they came to this earth. I mean, I don't feel like she needs to state the obvious, right?
Mm-hmm,
Like,
mm-hmm. Yeah, no, I
it's
think they're
it's
doing a
the obvious.
disservice.
They
Yeah, a
are.
disservice because, I definitely see that narrative on social
Right.
media, and I do feel like a meanie when I have to point out like that's probably not her eggs.
Not.
definitely
No.
some intervention there.
Right.
In my experience, and I've been doing OBGYN, including residency over 25 plus years, I've
Yeah.
had one patient spontaneously get pregnant at 50, and that was with a 20-something-year-old partner.
Wow. Good for her.
But only one,
Yeah.
like, that I took care of during pregnancy too,
Yeah.
So unfortunately, miscarriage rates are higher as well, if you
Yeah.
spontaneously conceive in the 40s and things like
Right.
that. So these are
Yeah.
things that people have to factor.
Yeah. Absolutely.
So, what is like insurance coverage like? You're in California, so you can speak to California, but if you have any thoughts about what it's like nationally or, what your sense is of that.
Yeah. I mean, insurance rarely covers it. It just depends on where you live, though. So in the Bay Area, this is the tech capital of the world, I think. Most companies are covering it if you work in tech. There are certainly other industries that are now covering it too, but for the most part, most people do not have coverage unless it's for medical reasons like cancer, for example. I mean, I would love to make egg freezing as accessible as birth control. And I do predict because of the drop in the live birth rate, it will be. I
Mhm.
think birth control, you can get it from the pharmacy, go to your doctor, no problem. Egg freezing will be like, yep, you're ready for it. Just go see the doctor and it will be covered. And the government will actually pay people and incentivize people to do it because of what we're seeing right now in our society. So I do predict that it will be easier and more affordable, if not free, but, you know, maybe in a generation from now.
Okay, yeah, that's really an interesting perspective. What about the current? Like, do you follow the politics and around this issue? And,
I
I
do.
imagine you have to. And I'd love your
Yeah.
thoughts on what's going on now and whether you think
Yeah.
it's, good, bad, ugly.
Oh, it's
Um,
super ugly. It's really
yeah.
cruel. We have a president who campaigned on IVF coverage for all. And
Hmm.
then he basically tricked everybody. And not only is he not covering it, he's only covering fringe fertility treatments. So fringe would be like these natural, NAPRO type of
Hmm.
treatments, which are restorative fertility treatments that are anti-IVF. So he did that very subtly and it has gone unnoticed because there's so many other headlines. So he's trying to distract us with all these other things. Like this week it was Tylenol causes autism to scare all those women that would have been upset about not, him following through on his campaign promise. But he will never cover IVF. Uh, and it's just not going to happen
Yeah,
in
it's
this
really
current
devastating
administration.
that.
Yeah, so we're being robbed of our reproductive rights every single day in this country. It's a very dangerous time to be a woman trying to have a baby.
That's really interesting to hear about him. I wasn't aware of that
Yeah.
he was supporting funding of the natural movement,
Yep. Yep.
way to preserve
100%.
your
Because the
fertility,
natural
which is,
movement. Yep.
yes, which sounds so wholesome and
Yeah.
wonderful, but it's not tested and proven to be beneficial. And this is one of the things that does drive me crazy in general with this whole Maha movement is it's not consistently, and in fact, most of the time, it seems like not reliable information,
Right.
and it's supporting a lot of these like snake oil salesmen.
And that's exactly what they're doing. I mean, these practitioners believe that fallopian tubes aren't ever really blocked, and you can get pregnant even with blocked fallopian tubes. They put women on fertility treatments that clearly are not going to work, and they waste over a decade of these women's lives convincing them of this.
Right. And their fertility is actively declining during that time.
Yeah.
Terrible. Wow. I could keep talking to you.
Thanks. Same.
I know you're amazing. Thank you. You've educated me as well. So I would love to know, do you have any closing thoughts?
No, I mean, my only closing thought is, the more you know, the better things will go. So I just want patients to just be educated, not afraid. The process of being a fertility patient should be more education based, not fear based, and separate your emotions from the information. Don't allow the learnings about your fertility to cause you to spiral or be depressed. Just consider this empowering and use that knowledge to inform yourselves so that you can have the family that you've always dreamed of.
Wonderful. Thank you so much.
Oh, you're
Aimee,
welcome.
it's been a delight to speak with you. Where can my audience, what's next for you and where can my audience find you if they want to hear more of your
Yep.
thoughts?
So 2026, my book is coming out. So I'm actively writing it right now. Yep. I have my own IVF lab now called the Egg Whisperer Lab. So that's fairly new.
Amazing.
And people can meet me if they don't want to be my patients in the IVF class. So you can go to eggwhisperschool.com and learn more about IVF. I do about 2 classes a month. And then my YouTube show, Egg Whisperer Show. And you can find me wherever you listen to podcasts. The Egg Whisperer Show is there too.
Amazing. And you have social media handles?
All Egg Whisperer. Anywhere you can type in Egg Whisperer, except OnlyFans and Pornhub. Maybe in the future I'll be there too. I'm thinking about it.
You know what? I don't know. Yeah, it's like a great way to get an audience.
It is. I mean,
I'll
just wear a tank top. I have a very flat chest, so I'm not sure. I mean, I have zero cleavage, but maybe I'll just wear a tank and be like, this is what happens with your fertility.
On the last podcast I was recording, we were talking about, one of the recent podcasts I recorded, my guest was talking about how, you can use whatever's popular in the headlines to like hijack the conversation and steer it your way. So I'm like, I've been thinking about it. I don't know about, I think we should stay off of Pornhub.
I know, same. Or call it sperm porn. We'll post sperm videos. Maybe that'll get the guys' attention.
Those are interesting.
Those
are interesting. Some of them are really weird.
Yeah, they are.
Well, it's been a delight. Thank you so much, Aimee.
Thank you.
Bye.
Bye-bye.
Hey, these are my closing thoughts for today. In the patriarchy, women are encouraged to have babies and become mothers, but only on the patriarchy's terms. Women's access to fertility treatments is limited, and there is gatekeeping, allowing only those who meet the right criteria in terms of wealth, race, gender, sexual orientation, and marital status to have access. In the Gynarchy, we support women's freedom, autonomy, and choice about whether they want to be mothers at all, and also all women's rights to fertility care, including the ability to decide when it's the best time for them to have a baby during their lives. So down with the patriarchy and up with the Gynarchy. Thank you so much for listening. Did you enjoy this episode of the Gynarchy Podcast? Know someone else who might enjoy this conversation? Make sure to subscribe and share the show with your friends and family. Find us on Apple, Spotify, YouTube, and just about anywhere you find podcasts. On social media, we can be found on Blue Sky, Instagram, and TikTok at The Gynarchy. Thank you so much for listening.